The news has been filled with stories of angry opponents of President Obama's health care proposal and those bills being crafted and debated by Congress. Based on that coverage, you might believe that the majority of people in this country are satisfied with the 47 million people living without any health insurance. But there is resistance to the corporate-sponsored movement to disrupt the town hall meetings. One such example took place in Rocky Mount on August 11, 2009. The meeting was sponsored by African-American Congressman G.K. Butterfield of the 1st Congressional District of North Carolina, a black majority district, and hosted by African-American City Councilperson Reuben Blackwell. The event was supported by the NAACP, activists from the Health Access Coalition, Healthcare for All Now, as well as single-payer advocates. Members of the organizing committee for Rocky Mount People's Assembly and Citizens for Fair Utilities attended, along with 700 other folks. The majority of people wanted to show their support for a public option and to tell their stories.
The need for all people to have health care. We have a slogan, health care for all in a real democracy. Health care for some is a real hypocrisy. There's a movement, a racist movement going around trying to attack health care for all. And by attacking health care for all, they're attacking health care for poor, and especially those who've been discriminated against and denied adequate incomes in order to be able to afford health care. That's African Americans and Latinos. So I'm here as part of a movement demanding single-payer health care for all, which is part of a broader movement for social justice. And that's why I'm here.
I've had a personal experience with the healthcare system. I'm a caregiver for my daughter who became paralyzed, and is going through that process of seeing her being denied things, even though she had been working, she had insurance, but once she was hospitalized for a long period of time, she was out of work, and therefore she could no longer pay the premiums. And once you're unable to pay those premiums, you're denied healthcare coverage. So basically I'm here so that all those people who have those type of situations, that they can be included, so everybody can have health care and get the things that they need.
Medicaid, because I have pre-existing conditions, and why do I have to sign up every year when they know what I am? Why can't it go for 3 years or 2 years without signing up every year? That's why I'm here. I need it. So I need Medicaid all the time, and they have cut it off now. I'm 74 and I want it back. I worked I plowed the mule long enough in the country, I deserve it. So I'm the one sitting out there be raising hell.
Republicans, the insurance companies, the pharmaceutical companies, the hospital association, and the specialists. And we are opposed to Obama's health care plan because it'll make health care more affordable, more effective, and will make our country healthier. And that's the last thing that we in the insurance industry want. We are opposed to good health care because we want to make money off of health care. More profits, less health care. Health is wealth.
Eat apples. 5 apples a day. That's all you need. 5 apples a day. What about old-fashioned just health care with your family that you offer?
It's about bootstraps. Now you want to add a character. So we are here today because there was a group called Billionaires for Bush, which existed in 2004, to try to ironically expose the hypocrisy of the ruling class in this country and the horrors of the Bush administration's policies. So we're here today to try to prove that the people opposing healthcare are actually really, really far to the right and are really scary people who should not be part of this discourse. We should not be having a discourse over healthcare or no healthcare. We should be having a discourse over what kind of healthcare works for our communities. And that's unfortunately not what's been going on because this small minority of people have hijacked the entire process. So we hope to shed light on that today by showing how extreme these right-wingers are who oppose healthcare by getting as extreme as you possibly can.
I want a public option for America. I don't have health care and I need health care today.
Of reform for health care because we have such a large number of uninsured people in America who really need to have proper medical care. And I'm here to support our congressman in his efforts.
First of all, I'm here to support our President Barack Obama and his new health care plan for all citizens here in America. And I think it's a very important time in this history that we should participate and voice our opinion and get on board and support our president. I think this is an excellent thing that he's doing for our country. Every citizen in America should have access to affordable health care. Well, people who can't afford, I think he has those people in mind. And I think the main thing is to get the healthcare industry, those big companies, out of choosing who get health care, who does not. You know, I know several situations where they chose which surgery a person should have, and I don't think they should be in the hands of a big company that's out to make profit.
We're going to ask that Bishop Taylor Parker with the Truth Tabernacle Ministry come forward, leads us in prayer, and gets us going.
At the core is a consumer protection bill. And if you want to debate some of the particulars, if you think the small business exemption is not high enough, if you don't like the design of the public option, all of that is still being debated. And it looks very different in the Senate bill than it does in the House bill. So if there's a reason to get involved and say, this is what I think the public option should look like, or I don't think there should be a public option, you can say, this is what the small business exemption should look like, these are the tax credits for small businesses. But at its core, we believe that consumer protections are good, that we should not charge people with pre-existing conditions more, we should not charge women more than men for insurance as we do now. Then you should at least just support the bills in general and get involved and say, this is what I think small businesses should get. This is the exemptions that I think small businesses have. This is what I think the public option should look like. But fundamentally, it's just consumer protection.
Thank you, Adam. It's the right thing to do. Healthcare shouldn't be for those who can afford it. Healthcare should be a basic human right.
My comment is that, given that no one plans to be sick, health care should be a human right and not a privilege. We need a health plan that guarantees affordable, quality health care. There are more than 46 million people without health care in this country. The only way to guarantee that everyone can have coverage is to take the insurance companies out from between the patient and their doctor. A single-payer plan is the preferable thing, but that is not even on the table. We need and must have a strong, affordable public health option that guarantees coverage for everyone. If we end up with something that is watered down from where it is now at the House, we will be back behind from where we started. We want a quality public option on the table. Otherwise, we are back behind. We still will not have guaranteed a human right that should be for everyone in this country.
Thank you.
For the past 4 years, I've been a caregiver for my beautiful daughter who became paralyzed. I most definitely hope that these things can be changed. As a caregiver, I witnessed my daughter being denied change in her wheelchair, things that she needs to keep her health up. I have on my hand a catheter. People who are in wheelchairs, they have to take care of things a little different than the rest of one or two of these capitalists use it and sterilize it and reuse it. And anybody who knows anything about sterilizing anything, it doesn't always work, does it? You know, so we're asking our most vulnerable people to do all kinds of things they really can't do. And what I'm praying is that as we make these changes, that we keep in mind the things they need, such as their therapy. Their therapy is continuous. If someone doesn't come in and decide, oh, if you don't feel it today, you weren't able to do therapy, someone to cancel that therapy. I'm asking that as we pass these bills, that we keep in mind the equipment that these people need. They need equipment that can sustain their lives. Equipment such as wheelchairs, they break down. So you see the people doing wheelchairs? Well, that hurts those wheels for those wheelchairs. People who are paralyzed, and there are other things that people need, they need a thing when they come out of the hospital called a standing frame. And they don't stand every day for at least a half an hour. They're not allowing their body's blood to circulate. So you don't know this if you've never been in the hospital and had these things denied for you. My daughter worked for the United States government. She was employed, and she had, when her leave ran out, that she no longer had any coverage from Care First. I got a bill in the mail for $486 to pay for someone who's no longer employed.
The lady makes a very good point.
And I'm thanking you for covering these points. And please, if you do this, keep in mind the dental program. Because, you know, they have a dental program. That's not a luxury. Am I right or wrong?
Thank you.
That's a necessity.
Salary Muhammad, I live here in Rocky Mountain. I'm very concerned about the divisions that existed historically in this country. And they're rooted in the fact that everybody don't have an equal access to the basic requirements for human life. The Constitution one time said that black people were not citizens, that we were free people. We had to oppose that wrong. So to say, when you challenge the Constitution, if the Constitution is wrong, we must challenge the Constitution and not be afraid of that. The core question is whether or not, as human beings, we want everybody to have health care, or whether we're just arguing against systems, you understand, that allow for privilege. Allow for privilege. Those who are opposing Obama's plan, and I don't agree with all elements of the plan, I agree with the core element of providing health